Okay, so good day everyone. What we'll be talking today is about phlebotomy, the proper patient ID, and skin puncture. So, muna first na ito nga pagsarihaan because previous topics are able to um, undergo like different parts of microscope, the circulatory system, and the like. I'm not able to tackle it in the previous semester. So basically, they are just review of your kind of mga with the knowledge that you have, with the information that you have. So kindly just refer to those materials that I was able to send, and please be guided on the things na yung mga nalimtan and mga things nga pwede na to pwede pa na to i-correct if you have any questions. So again, we'll be talking about proper patient ID and skin puncture. So for this subject, for this course in phlebotomy, kay though you dili mo maka-perform ani, but just kindly take note on the important matters na ato nga pagsarihaan. So first, what are the characteristics of blood? So ang blood kay fluid form na siya in vivo or inside the body, tungod kay we have in our bodies we already have anticoagulants, but once exposed outside the body it coagulates within 5 to 10 minutes, and the appearance of the blood kay color red na siya due to the hemoglobin present sa ato nga mga blood, and the pH of our blood kabalo dapat ninyo mabalaan because we are medtechs. So it is 7.35 to 7.45. It is thick and viscous, and it is 3.5 to 4.5 times thicker than the water. For males na adult, kay naay 5 to 6 liters of blood, while for females kay they have lower amount of blood, which is 4 to 5 liters. Now, this is an example of a blood. So, as you can see, medyo thick and viscous siya. And if you try to makabatay mo ano, line of color ang blood, ano ba? So, again, oxygenated blood mo appear siya as bright red in color. Now, deoxygenated blood is deep red to purple in color. And again, going back, it is thick and viscous. So it is 3.5 to 4.5 thicker than the water. So, kabalo jud po ko tanan nga you're able to see na a blood sample or a blood if ever mga samad mo or masakitan mo. So this is not new to you. Okay. Now, what is the composition of our blood? We have three portions of our blood. We have the liquid, we have the solid, and we have the gas portion. So, in liquid portion, we have two types of samples or two types of fluids. So, the first one is the plasma. Now, the plasma, kay mo na siya ang portion sa ato ang unclotted blood, or meaning ang blood sample na naa sa tube nga walay anticoagulant. So meaning present na siya ay fibrinogen present ani nga fluid. Now, if ang ato ang sample nga gigamit kay na ay clotted siya, kay meaning wala na siya fibrinogen sa iyang nga sample. Now, the solid portion, we have the red blood cells, we have the white blood cells, and we have the platelets. Now, for the gas portion, it involves an exchange between the oxygen and the carbon dioxide. So you can see here, ang plasma kay nag-contain of fibrinogen. So for example, EDTA kay walay anticoagulant. So meaning, dili gyud mo clot ang ato ang ato ang blood sample. Now, na siya white blood cells and platelets, and napo siya RBCs. This is the buffy coat. This separates the RBCs from the plasma. And now we have the clotted blood here, serum minus fibrinogen, and ang clot, so ang blood cells in fibrin clot. Now for the next slide. So this is the smear of a peripheral blood. So I don't know if you're able to see a smear or a blood smear. So kani siya man na to mga red cells. Oh, this is our erythrocytes, and we have different types of our WBCs or our white blood cells. So we have here the neutrophil, we have the lymphocytes, we have the eosinophils, we have the monocyte, and we have the basophils. And also we can also see sa ato ang peripheral blood smear kay ang mga platelets. Now, preparation of blood sample. One of three different specimens may be used. So it could be whole blood, it could be serum, and it could be plasma. So first, a whole blood specimen. It should be analyzed within limited time because through time, ang cells kay mo lyse sa whole blood ng sample, which will affect the concentration of our potassium, of our phosphate, and our LDH or lactate dehydrogenase. Kay some nga metabolic process kay mupadayon siya, and it will alter the concentration of our sugars like glucose and lactate. So again, a whole blood kay also we have strict na preparation through this kay it will affect the concentration of our mga chemical na mga substances which is which is usually tested under clinical chemistry. So if ever gani nga na di siya ma-process on time kay it will give us a false positive or false negative results. Now the difference between serum and plasma is that the serum is the same as plasma, pero ang serum kay wala siya nag-contain og clotting factors. Na ang plasma kay nag-contain siya og clotting factors. Now serum and plasma has all the same contents of electrolytes, enzymes, proteins, hormones, except the clotting factors. And ang serum is mainly used in chemistry lab and serology. Now ang plasma kay usually used sa hematology na sections. Now for the next slide. So the coagulation reaction, so clotting factors with calcium, okay, it produces thrombin. Now fibrinogen with thrombin produces fibrin strands. Now specimen quality. So guys, in phlebotomy, it is very important na we will be able to really perform it well because if yung siya lang nga kanang ang phlebotomy kay simple naman kaya na ang skill for the medtechs, but just take note if ever gani dili siya ma-perform og tarong it will lead to serious cases to patients, and also it can cause serious cases to the medtech who is performing it. So again, the critical areas to need to remember when doing phlebotomy is the appropriateness of the test request. So kung unsa ang test request nga gikinahanglan kay musa ang mga we need to be careful on the tubes that we'll be using, on the materials that we'll be using, on the type of tubes that we'll be using. And also patient and sample identification, very important nga we would interchange the samples of patients, and also we'll be able to label them properly kay para pod we'll be able to give the correct diagnosis to the patient nga na siya jud ang owner or siya jud ang tagayaan ng sample, and criteria for acceptance and rejection of specimens, and communication of an interpretation of results. Now, specimen collection is the first step in most laboratory analysis. Now, accuracy and precision can be measured by the proper specimen collection and handling. Test results are therefore said to be as good as sample collection and handling. So, if unsa gani ang integrity sa imong sample, kay nga na po ang integrity sa imong test result. So, meaning, if bati imong sample nga nako or bati imong pagkakuha imong sample, di ka mag-expect nga nindot ang result nimo makuha kay tungod dili man nimo siya ma-process og taro tungod kay bati imong sample nga naa. That is why in every collection of specimen we'll be doing, we need to be first very careful. We need to be kanang accurate in the things that we are doing kay para it will give us the best results and the patient be able to receive the best treatment or the best na diagnosis for them. Now ang quality sa specimen kay mo mo affect different factors like kung sa siya pag-collect, kung sa siya pag-transport, and kung sa siya pag-process. So kung nindot ka na siya pag-collect pero pati pag-transport and pati pag-process, wala gyapon. So, dapat nindot siya pag-collect, nindot siya pag-transport, and nindot siya pag-process. That is why crucial po kaayo gyud ang role sa mga medtechs in the laboratory. Now, phlebotomist as a laboratory ambassador. So, ang phlebotomist, kamura na siya ang laboratory staff nga makita sa mga patients. That is why we need to be very good representatives of the laboratory staff. And ang phlebotomist kay expected gina sila nga mo kuan kanang mo perform sila well in front of the patients or in front of the quote-unquote customers. And we need to bisan pag unsa nakamaldita or sa kamaayo ang pasyente kay dapat yapod same ang atong treatment sa ilahang tanan. Kay tungod we won't encourage na kanang we want to be professionals in everything that we are doing. If the patient is unhappy, sincerely apologize to them and listen to find out about the details of the problem. So, priority gyud nato gyud pod ang care nga mata nato sa pasyente. Ana ba? Dapat less pain ang ilang madawat. Dapat they will kanang dili pod maka-cause ni og trauma sa ila every time mo-undergo sila og kanang blood collection and specimen collection. That is why we need to be good representatives of the laboratory. Now, patient identification. In patient identification, we need to identify the different types of patients. So first one, we have the conscious inpatients. So these are kanang normal lang ang mga pasyente. So we need to verbally ask their full names, and we need to verify it using the ID bracelet, which includes their first and last name, the hospital number, the unit number, the room, or the bed, and the physician's name. So inpatients meaning those patients who are admitted inside the hospital, and conscious meaning kanang they don't have any kind of limitations on themselves, like capable gyud sila mobuhat on the things na kaya nila nga buhaton. And now we have sleeping patients, so we need to wake them up before blood collection kay alam po di mo tusukan ng tao nga kakatulog. So, maunsa pa lang niya na ka na, moigking pa lang niya na, or mapatiran pa lang niya ka, or masumbagan pa lang niya ka. So, wala nga dapat, imugid sila nga pagkawon kay they are still conscious man, though nakatulog lang gid sila. So, but the time that they wake up, kay conscious na sila nga in patients. So, once again, also carefully ask their full names and verify it with the bracelet that they have. Now, we have unconscious patients or mentally incompetent patients. So, we need to identify them by asking the nurse nga naa sa station or naa sa iyang room, or any relative nga naa dito. Sa gid pod dapat identify po nimo gyud kung kinsa gyud ang pasyente. Kana magiusahay nga ang pasyente mo naghigda sa bed for the kanang watcher. Nya ang katunanon nga watcher mo naghigda sa higdaanan sa pasyente. So we need to be very careful on those things kay kanang sa iyo pala niya nga tao yung makuhaan ba kay wala nimo siya gipangutana og maayo. So man it is important to really ask. Dili gid pwede pod nga ikaw ang musulti sila yung pangalan if capable pod sila musulti kay there are times na wala na sila naminaw tarong yung ando ra na sila nga na ba. So we need to be very careful on that. And infants and children, we need to identify them, or as a nurse or any relative that may identify the patient, or by using the ID. Now, at outpatient patient, so we need to again verbally ask their full names, kana mga walk-in na ni, kana magpa-laboratory request, mga laboratory request kay magpa-process o kanang sa ilang blood samples, yan, or na sila mga naka-feel sila nga sila ipambati sa lawas, or they will undergo a check-up. And also, counter-check them with any valid IDs that they have na naa sa picture. If the patient has ID card or bracelet, same manner as with the hospitalized patients. Now, we have the pediatric patients. So, kung bata gani, dapat yuta nga gentle, then dapat yuta nga i-treat ko nato sila with compassion and with kindness. Dapat di po tama ka ng magsiinisog sa mga bata kay all the more nga mas madlok na sila nimo, and very lisod gyud kayo gyud kung magkuha kag bata nga kiat, magkuha ka og bata nga lihukan. And ang pinaka-hassle gyud sa part if bata imong kuan og dugo kay mas kusog pa mangisog ang ilang mga lola or ang mga bantay sa ilaha kaysa sa mga bata. So murag ma-pressure na noon ka ba. That is why we need to kanang interact with them, kanang paningkamutan gyud nato nga ma-communicate ag bata. We will try to please them sa ilang mga ganahan nga buhaton, and that para pud maka-reduce ta or maka-lessen ta sa fear na ilang gina-face ana nga time. And we need to acknowledge the parent and the child. Be friendly, be courteous, and be responsive. Allow enough time for the procedure kay medyo yung mga times sa kanang nagtusok na kanya, kailangan ka magtusok balik, ka nang naglihok ang bata, ingana. Yung sagad po, kinay mga times, wala pa ka na, mo pagduol ni mo gahilak na mga bata. I don't know if tungkol ba na sa imong naong, or tungkol ba yun na kay mahadlok na yun sila makitawag ka ng mga medtechs, ingana ba. Or mahadlok po sila sa idea, kung anong dugo. So, mo na nga, napatig ko na to, dali on tanan. Okay, wala dyan angay dalian. Now, for adolescent patients, when obtaining a blood specimen from adults, it's important to be relaxed and same point, communicate well. And again, also guys, we need to remember nga, before and after, dapat musutigitan nila sa procedure na itong pambuhaton, and we will instruct them and we will inform them on the things that we'll be doing. So, hi ma'am, I'm your medtech for today. So I'll be obtaining blood sample for your blah 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 blah, and also inform them of nga medyo sakit na lang sa ang procedure ngayong pambuhaton. And allow enough time for the procedure, establish eye contact, and allow the patient to maintain a sense of control. Geriatric patients, it's important to treat these patients with dignity and respect. Do not demean the patient. It is best to address the patient with a more formal title such as Mr., Miss, or Mrs. Because senior patients may enjoy a short conversation. And also po, if tabian na gid pug kaayo ka kay dugay na jud pug kay mumauman, yan na ba. So dapat gentle gid pud ta mostorya sa ilaha kay napoy usahay nga medyo maglisod na sila og dungog, yan na ba. And try to really get the exact details or exact information sa ilaha para dili po ta magkasinayop sa pag-process sa ato ang mga samples. Now, for skin puncture, capillary puncture, okay, it is a type of blood collection obtained for usually for children. Now, it is also known as thermal puncture, and the length of the lancet na itong gamiton kay 1.75 mm, and the depth of the incision should be less than 2.0 for children and less than 2.5 for adults. The cut should be oriented across the fingerprints. If makabantay mo na ay mga lines sa inyo ang fingers, so try to observe, and dapat diya ninyo itusok ang inyong lancet. It will generate a large drop of blood, kung ano siya, ball of blood. Sakto gini yung pagkatusok, perfect juga na nga ball of blood ang makita. So don't worry guys, kay I'll be showing you a video nga nag-perform ko o capillary puncture. So as you can see here, either sa kanisa kamot, so try to cut it sa across the fingerprints, and if sa heel gani or sa imong tiil, kay it is either lateral side of the heel or the medial side of heel or the posterior tibial artery. Now, preferred sites for newborns and infants kay lateral plantar heel surface, kay sus ka ng mga bata, but the most common nga itong ginagamit kay the third and fourth finger of our non-dominant hands, so the palmar surface. So again, across the fingerprints. So see here, avoid using the thumb, avoid using the index finger, and avoid using our pinky nga finger. So pinakalisad nga site for capillary puncture kay earlobes, though na mga test nga mag-record pa sila nga sa earlobes ta mo kuha. Now, sites to avoid: inflamed or pallor areas, cold and cyanotic areas, congested and edematous areas, scarred and heavily calloused areas. So again, avoid na mga areas kanay mga irritations na mga infections, dili po ta pwede ana mga nanghupong nga mga kuan or either na mga allergies ilang nga mga areas. Usa po dili po pwede ang kanang mga kanang hupong lagi or kanang ginana nga mga samples. Make sure nga ang imong yung site okay, perfect good siya, like clean good siya ba. And also kanang mga naikubal or sa panadira kay dili sana pwede tusukan nga area. A procedure for skin puncture kay again, patient ID, choose an appropriate side, but ako kay usually sa fourth finger jugo mo tusok kay mo man na ang finger na pinaka closest sa circulation gikan sa imong heart. And also choose an appropriate site for the collection. Clean the site with alcohol. Hold finger between your index finger and thumb. So don't worry guys with the procedure kay pakita rin po na ko na later sa video nga ako buhaton. Now, puncture the finger using a quick, smooth motion. Like, paspasan niyo siya, inigtusok niyo mo kay, di ko niyo duot mayang lancet kay mo ni ang pinakasakit good sa tanan. If abi ninyo masakit ang puncture, masakit good po. Pinakasakit yun ang skin puncture kay ma-feel ko mo ang pain. Isa kung siya kagamay, pero sakit yun guys siya. Now, wipe away the first drop of blood, collect the blood sample, apply pressure to puncture site, and label specimen inside of patient. So, muna siya ang mga pictures. Muna siya ang lancet na nasa letter B. So, muna siya, if perfect siya pagkatusok, kaya mag-produce siya og ball of blood. Wipe the first blood, and then, kuhaan sa slides, if ever kailangan blood typing, pwede po sa capillary tube, and pwede sa katong microtubes. So, materials that we'll be needing, we have alcohol, gauze, bandages. So, the Clinical Laboratory Safety Institute can recommend 70% isopropyl alcohol to clean the capillary bed of the skin. Now, gauze or cotton balls are used to wipe away the first drop of blood to eliminate alcohol residue and excess tissue fluids. Okay, so first nato nga puncture, ang napagidira kay ang mga tissue fluids nga present sa itong blood sample. And also, mga residue sa mga alcohol nga ato ang gi-apply kato nag-clean sa area. And also, bandages are used to cover the site after collection. So these are example of our lancets. Na lancets nga kanaigo na lang nimo iduot kay magawas na lang ang kanadili kailangan ikan standardize ang pressure nga may apply pa kay nara po siya limitation. But kaning sa second picture kay kana ikaw jud makabuot kung saan mo siya pagduot, saan mo siya pagkuha, yan ang siya kadali. So that is why you'll be able to experience this soon. So kana siya, lancets are sterile, disposable, sharp instruments, and their blades or points must permanently retract to prevent sharp injuries. So nana siya kana portion dira nga na bevel. So kabalo sa jud ka kung dapat always bevel up nga na mga portion nga na mugamay siya. I know kabalo naman ang term. So musad na i-take note sa nato while performing skin puncture. Warming device. So we need to warm the area to increase the blood flow. And also, water temperature must not exceed 42 degrees Celsius or it could scald the patient. So we have sealants. So, ginagamit ang sealant kung atong gina-seal for sa iyang word nga sealant. So i-seal gud nato ang capillary tube para dili mugawas ang dugo sa capillary tube. Or the microhematocrit tubes, and the clay plug should be 4 to 6 mm long. So imo na siyang ipaturok dira ang imong capillary tube and makakuha na siya og clay. So these are examples of our microhematocrit tubes. Indications for capillary puncture: it can be done if small amount of blood is required or kung maglisod na ko kay wala na dyan other sites for venipuncture kay that is the time perform tag skin puncture and katong gamay nga tube ang ato ang gamiton. Ito yung nakita before. Or pwede sad capillary puncture ka kung fragile kay ang veins nga naa and naay mga other arm nga nakasave for dialysis, nakasave for chemotherapy, nakasave siya kay kanang na-injury, nga na like wala na dyan kay site makuhaan. So that is the time pod nga pwede ka for capillary puncture. And also blood is to be obtained for point of care testing procedures such as glucose monitoring. And capillary blood is the preferred specimen for some tests such as newborn screening. So, yung advantage, kay pinakasayon buhaton, accessible to the operator, and ideal good po ni siya for peripheral blood smears kay fresh pa man imong blood sample, wala pa managi o wala pa siya ni expose kaayo sa air ba. So it is really a good representation of the blood sample nga naa sa imong lawas. And disadvantages kay gamay ra pud nga blood imo makuha kay since capillary sa man ang nag-supply og blood diha, and additional and repeated test cannot be done. So dili ka pwede mag-rerun sa imong blood sample kay tungod gamay ra imong sample nga nakuha. And blood nga imo na-obtain kay na tendency nga mo hemolyze easily. Specimen quality, anticoagulated capillary tube heparin with red band. If EDTA kay anticoagulated blood transferred to a non-anticoagulated capillary tube with blue band. So capillary tubes must be 2/3 to 3/4 full. So avoid air bubbles and spaces and sealed first with a clay sealant, then paraffin. So proper labeling, patient's full name, patient's age, date of birth, time and date of collection, and initials of the phlebotomist. So kani arterial puncture kay dito nato siya i-discuss sa penny puncture. So that's it for today, guys. I hope you'll be able to learn something from this. You were able to take note on this. And again, kindly watch the video that I'll be sending to you nga nag-perform ko sa capillary or sa skin puncture. So I think that's it for today. For the next week, we'll be having our discussion on venipuncture. Thank you, guys, and God bless you always.